and wonderful midwives. How we all doing? Welcome back to Nurse Brainy Academy, an academy by God's grace for simplified lectures. So in this academy, we always acknowledge God first. So we give God Almighty all the praise. So we have a discussion. A lot of students need this discussion because of their upcoming exam, which is the council exam. And we'll be using a live discussion so that in case you have questions, you can as well drop your questions. Now, I want all the wonderful students that join this live to share this live. I'm going to give you 5 seconds to share to your classmates so they can join. 5 seconds. Important milestone in the journey of every student nurse and midwife. It is more than an academic examination. So, but many students always approach this examination with fear, uncertainty, anxiety. Please make sure, all my reps, make sure you share this to your class groups so that many students will join. Because one of the reasons why we are having this discussion is so that your schools can achieve 100%. It will help a lot of students. Are we together? And if you have questions, make sure you drop your questions also. Now, there is number one truth. Get your pens and your books and write these important key words I'm going to be dropping. Now, the number one truth in council exam is that council exam is passable. But people can fail council. But though people can fail, you are not, and you should not have the mentality that you are among those that can fail. Now, in this academy, soon we'll be having an IELTS class that will help students. Also, a simplified lecture on this. But now, we are focusing on this council exam. You should have number one truth that you are having about this council examination is that it is passable. You can pass. People do pass this exam. A lot of students sit for this council exam. Thousands of students every year sit for this council exam. But there are things you need to know. You need to study consistently. You need to develop clinical reasoning skills and have certain understanding. So what is this council exam all about? This council exam is like a standard, a licensure to approve you, whether a nursing student or a midwifery student, that you will practice and you can practice, because your profession is not about traveling abroad only, or you want to make money, but number one thing is what? To save lives. So this council exam is the number one way of appraising students. Do you know these things? Can you do these things? So that is the number one essence of this council exam. Not those students can fail at this council exam, but like I said, number one, you are not going to fail. But I'm just trying to explain that the reason for this council exam is to appraise students if you really went to school, because you are dealing with lives. And because of that, there are certain knowledge you should know. That is why whenever I lecture my students, I always tell them that you don't cram for any exam. You do what? You what? Have knowledge. You don't cram. Because counsel is the reasons for counsel is to what? To test your clinical ability, your ability to solve clinical problems, your ability to understand patient fast and understand patient safety, your ability to make appropriate nursing decisions and midwifery decisions. That is what this council is testing students in. Now I'm going to give us 5 seconds again to share so that more students will come online. Now I'm getting that information that I should give these 5 seconds. So quickly send to your friend. What are the purposes of council examination? Number one purpose is to protect. Number two is to assess your professional readiness, whether you are ready to work. Number three, to evaluate your clinical judgment, to assess you. These are the things that the council exams are doing. Now, where are the places questions can come from in these council exams? Where are the places? Now, we have questions can come from FON. So you need to know your FON very well. You need to know your theories because questions can come from FON. I'm going to be intertwining both midwifery and the nursing also. You need to know your child health. You need to know your community health nursing. You need to know your mental health. Your pharmacology, you need to know these places. Your anatomy and physiology. Your management, you need to know it. Your ethics, you need to know it. Your medical surgical nursing, you need to know it. All the courses that you are being taught, you need to do what? Make an in-depth study about it. Now, what is the difference between school exam and this council examination? Now, the difference between this council examination from school examination is that for school examination, it is your lecturers that is setting it. But council examination is coming from Abuja. And there are things that you might have not been taught that you will see in the exam hall. There are students that might enter the hall. Everything that will be coming out for every question, you'll be asking, why didn't they teach you this thing? That is because the question is not coming directly from your school. So in that case, you don't study your council exam preparation the way you are studying for your school exam. How can a student that is preparing for council be reading just his or her school book? Is wrong. You cannot be preparing for exam. Please notify me. Can you hear me? Notify me in the comment section. Can you hear me? All the wonderful students that are live, joining live, notify me. Can you hear me? And if you have question, you drop it also. So you cannot be preparing for this council exam and you are studying the way you are studying for your school exam. It's not possible. Now, one of the reasons why we're having this class and this discussion is that because I want my students to pass their council exams once. Though we still have a lot of syllables to cover for this discussion, but I'm just giving an introduction today. You cannot, always have it in your mind and your brain is said, you cannot prepare for your school, write it down. You can't prepare for council exam the same way you're preparing for school exam. How can a student that wants to now students are always chat me and some both my physical students and my online students, some will ask, do students fair counsel? Yes, students can fair counsel. Don't think that 100% is when the council body looks at your school and say, yes, we have more intelligent students. No, you don't stand under the umbrella of anybody. Council exam is personal. You are going there to prove yourself. You're not going there to prove for the school. So, number one fact you are learning tonight is that you cannot, I said it again, you cannot prepare for council exam the same way, the same momentum you use to prepare for your school exam. You can't use the same momentum to prepare for your council exam. If you are reading 30 minutes for your school exam, you need to read more than that for your council exam. If you are using your school notes to prepare for council, you are wrong. You can't be using your school notes to prepare for council exam, because council is coming from an outside body from your school. It's coming from Abuja. So there are many textbooks where they can draft questions from. So you cannot just be reading from, that is why you need to make research. You cannot just be reading from what your lecturers give you in class. You need to make in-depth research. That is why whenever I lecture my students in the private lecture room, I always tell them, in this academy, you don't cram. You do what? You learn. Now, previous years, we've all have come to the knowledge that you cannot prepare. You need more intensive preparation for your council. We've all understand that. If you're reading 1 hour for your school exam, you need to double it. You need to triple it. If you're reading 3 hours, you need to double it and triple it. If you are reading with your notes, after listening to Nose Brainy today, drop those notes. Let those notes be an addendum. Go and get textbooks. Go and make research. Read intensively. If you see a topic, study it. Don't read it. There are students that will go and get a PDF and they will copy everything from the PDF to the notes verbatim. And when they are done copying, they will say they have read. No, you need to do what you need to have an in-depth study. Now, I always tell students that questions will not be repeated. That is why you need what? An in-depth study. When you hear of hypertension, you make an in-depth study about it. Are we together? Now, why do we've come to the knowledge that students can pass council and students can fail council? So why do students fail council examination? Now, failure in exam is not a student's lack of intelligence. Most failures occurs because of what? Avoidable mistakes in preparation. Failure can come because of a student's study habit, the way you are reading. Failure can come because of your techniques, the way you answer questions, the way you delay even with your time. Failure can come through that. Failure can come through, this one is very important, your mindset. Very important, your mindset. From the word mindset, where you set your mind, failure can come through it. Failure can come, like I said, through avoidable mistakes. Failure does not, now some students are listening to me now, And these students, all the wonderful students listening to me, are all intelligent and you all are brilliant. But exams like these council exams, they can shake both the brilliant and those that are not so much. You see those that you don't expect, you see them passing because of what? How careful they are. So failures can come because of avoidable, it can be avoided, can be averted, avoidable mistakes in preparation. Now, one of the reasons why students fail is poor understanding of nursing concepts. Poor understanding of nursing concepts. When you see something like a hypertension or diabetes, and you look at sure bets, and all you can do is to do what? Okay, diabetes is caused by insulin insufficiency of the pancreas. No, you, like I said, they don't repeat questions. Council no longer repeats questions like other years: 2019, 2018, 2017, 2016, 15, 14, 2020, 2021, 2022. From 2020, 2025, they stopped repeating questions. So you need to understand every concept you are reading. You need to have an in-depth understanding about it. When you see hypertension, you should know what is the reason. When you are studying about antibiotics, you should know what it is in pharmacology. When you are studying about triage, as I'm calling this, if you are studying very well, you should know the courses I'm calling. When you hear about sampling techniques, you should know what we are talking about without cramming. Osce is one of the most easiest practicals. And I will give a simplified shortcut on Osce in our private lecture room. Viva, very simple. But it all boils down to your ability to do what? Understand the concept. When you hear of shock, you should understand the concept. When you hear of NSAID drugs, anti-inflammatory drugs, you should have the in-depth understanding of that concept. You don't cram it. After tonight's discussion, I won't let there be a drifting back. If you know that you look at something and you just scroll through it, that is not the way you will read for this council exam. Because this I'm discussing today is for someone. And God wants to help that person. So you start having understanding about what you're reading. Stop glancing through nobody is chasing you. You need to have understanding about what you're reading. Please, if we're together and you love what I'm saying, I want you to notify me in the live session. That is why it is live. I want to keep seeing your comments. Notify me so that I will know that you're following what I'm saying. Are we together? Yes. Now, the second reason why students fail is poor study habits. Now, how can a student have a good study habit if there is no clear plan? You need to have a plan. You need to have timetable. One of the things students do is to have a brain timetable. No, that is wrong. You need to map those timetable out with your hands. All hands on deck. You need to write it down and paste it somewhere. When you wake up, you look at it. Don't have a brain timetable. Those timetables will serve as a clear plan for you. You need to have a reading group, a serious reading group, those that will motivate you. They are part of the study habit. Many students have a poor study habit. You read today, you leave it, you don't read the next day, you read the next you read that next 2 weeks. Your brain can't process like that. You need to have a good study habit. In the morning you are reading, in the afternoon you are reading. That's why you are in nursing. In the evening you are reading, you rest. So many of us are so engulfed with social media. Few months to your council exams, and many people you are preparing for your council, something that will determine your life tomorrow, and many students don't have a timetable. It is wrong. Are we together? It is what? Wrong. You need to have a what? Physical timetable, pasted where your eyes will see it very well. You need to have a physical timetable. Very important. Study daily. Make sure that one of the reasons why you should have a study group, is because they will motivate you. Make sure you are disciplined enough not to miss any day that you are supposed to have a course following your timetable. You make sure not to miss any day from it. Are we together? So the next is procrastination. Yes, I will study tomorrow. In the next, let me just scroll through the social media for some time. I will read later. Let me just watch away some things I will read later. You keep procrastinating. You keep procrastinating. I will start. Many of you have not started your Osce rehearsals. By now, you should be practicing your Osce. You gather people and start practicing Osce. But many students will not until few days before the Osce day. Many students will start running around in fear and in panic. And one of the things that can affect students is what? Panic, because it disrupts the biochemical process of the brain. You need to start now in your timetable. Let there be a space, a column for Osce rehearsals with your friends. Start it now. Early preparation. Don't procrastinate. Early preparation. Write them down. Write these things I'm saying down. Start now. If you've wasted January, February, March, April, May, June, July, as we're about to transit into August, which is a new month, start those things that you have left behind in procrastination. I will do it later. Let me read MedSurg this month. Next month I will read anatomy. No, all those things are wrong. That is why a clear study timetable will help you. Now, there is something that students do. They claim they know pharmacology. Yes, I know pharmacology, so I don't have to read it. That is wrong. Anything you leave will leave you. Even if you know pharmacology, make a timetable. Today, by so time will be pharmacology. Go and study those things you know. Some people, I know anatomy, I dissect anatomy. No, you are not only going to see anatomy in your exam. Read everything. All you are being taught as a nursing student or midwifery student, read everything. That is why timetable will help you. Don't claim you know pharmacology. Foundation of Nursing is my best course. I don't need to read it. You see students neglecting those places they think they are perfect in. No, this is your destiny. This is your life. You need to focus on all aspects. You read that pharmacology you know, read it again. read it again. The anatomy, read it again. The FLN, read it again. Research and statistics, read it again. Don't go and harbor or stand on the most difficult, the one you claim that is very difficult. You might see only 3 questions from it. That is why you need to read everything. And like I said, don't depend on your school notes. If you are in this discussion tonight and all you are doing is depending on your school notes, you are very wrong, because it is not a school exam. This is council exams. None of my students will fail these council exams. As you follow this discussion, by God's grace, with prayer, you need to pray always. You will not fail this exam. Now, the next is over dependence on past question. Past questions are very good. Past questions are very, very good. Please, now, all my wonderful students in this life, make sure you share now. Begin to share to your friends. Tell them to come to this discussion. Begin to share to your class groups. Tell them to join this discussion. A wonderful student just chatted me that she shared it, and I'm so impressed with that student. After this live discussion, I'm going to have a discussion with her. So share this to your friends. Tell them to join the class, because you need them also to pass. The reason why we are making this class a general class, Nosbrain is bringing out time, is because of we desire that every student and every colleges and universities come out 100%. So share to your friends. Tell them to join the discussion tonight. Now, I'm giving you some seconds. Now, having noted that we are discussing on overdependence on past questions, you cannot depend on past questions. Though past questions are very useful, but they should not be your only method of preparation. I will still make a plain discussion on this overdependence on past questions. Is as a wonderful student you are, you cannot just be depending on past questions only. You can use past questions. Now, what is the importance of past questions? Past questions is very important. It's crucial in your academic journey to passing this council exam, but though it should not be neglected, it should not be over depended on. Because one of the reasons, because like I always tell my students, that council will not repeat questions again. Council will not and does not repeat questions again. Because of what? Nobody sits down to drift question from sure bet again. Nobody sits down to go to explicit to draft out questions again, because of the innovations, the upgrade in the world today, the artificial intelligence in the world today. So that is why you cannot over depend on past questions. But those people that will not go to those past questions to drift out questions are the same people that will go and look at certain topics and pull questions from those topics. So you need to read your past questions, but you don't depend on past questions. That is where studying comes in. You need to study. You don't read. You will see a student, he or she will get a book and answer 100 questions. And after answering 100 questions, he or she closes the book, mark it and closes the book and claim that he or she has studied. No, that is wrong. That is very wrong. Are we together, wonderful students? Are we together? That is very wrong. You cannot just go and get past questions and you study, you read everything, you read and answer, you solve every questions, you mark it and you close your book. You've not read anything. You just answered the quiz. You just answered question. You need to do what? Study, because past questions will not be repeated. Is brain asking you to leave past questions? No, don't leave it. But you should be 50-50 as you're reading past questions, you are studying. You are having the mindset that past questions will not be repeated, but those topics that you've not been taught will be repeated. In this study for your council, you should not leave your Osce practicals. I always say it. Don't leave your Osce practicals. In that timetable, make time for your practicals. Put Osce there. Put viva in it in your timetable. Now, another reason why students can fail this council exam is anxiety and fear. Anxiety and fear, and lack of proper decision making. What are the things that anxiety can cause? It can affect your concentration. You see a student, he or she will keep shouting the name of God, running helter skelter. I always tell my students, before you enter the exam hall, sit quiet, don't move around. You are trying to maintain the order in your brain. Anxiety will bring confusion. Hey, do you know this? Do you know that? Oh, you forgot to read this. They say that this one will come out. They say that that one will come out. Anxiety. It affects your concentration, and your brain needs your intelligent quotient, your cerebrum needs concentration so that it can articulate very well. When your cerebrum is in order, your cerebellum also is in order. Your medulla oblongata is in order. But when you are having anxiety, every part of the brain is trying to maintain balance. Thereby, it will affect your score because of what? Examination anxiety, fear of failure. You failed paper 1 last year and you are afraid now. That fear can affect your concentration. Like I said, I don't want to go into the anatomical and the physiological aspects of what fear and anxiety can do to the brain, the neurotransmitters in the brain. I wouldn't want to go into that. I want our discussion today to be based on a lecturer to student discussion and encouragement. So remove fear. It brings confusion. A simple question, that this you're looking at this is when a people are being picked on a random basis, which is the answer is simple random. Confusion and anxiety, we tell you it is quota sampling, it is purposive sampling. Fear, do you know research? Hey, what if research comes out? What if you find pharmacology very difficult? What if pharmacology comes out? You find this topic in pharmacology is the most difficult. Blood grouping in anatomy is very hard. Fear or an anxiety. What does it do? It does what? It leads to poor concentration. Your brain is trying to manage the stress you are putting on it, thereby affecting your concentration. So you need to do what? Remove fear and anxiety. You need to make decisions. You need to do what? Make proper decision. Anxiety over Osce. You see students sweating, running around. Like I say, Nosbrain is saying it again. Before your exams, make sure you sit down quietly on your own. Sit down, no making of noise, no running around on the exam day, in case you want to listen to this discussion after. after tonight, make sure you listen again. Before your exam, sit down quietly. Don't run around. Don't roam around. Don't go and ask which one is coming out, which one is not coming out, which one do you know, which one you don't know. Sit down quietly to avoid anxiety. What did Nurse Brainy say that anxiety can do? It affects concentration because your brain is trying to balance your body system to maintain brain homeostasis, and because of that, it is affecting your articulation, your decision making portions of the brain. So you cannot perform effectively and perfectly in your exams if you are having anxiety, exam anxiety, viva anxiety, Osce anxiety. That is why many students fail Osce. Oh, they said paper 1 is very difficult. They said paper 2 is very difficult. You need to remove those mindsets. Are we together? Now, another reason why students can fail counsel is what? Poor time management. You see a student writing very slowly. 250 questions. The student, others are in 100. The student is still in 32. So if you are here and you know that your time management is still not in order, you need to start practicing it now. That is why I said join a study group, a serious study group. Don't join a group that is too much. Don't join a group that why they read the gist. No, join a serious study group. Don't join a group that is self-oriented, that only the one person is saying what to read and what not to read. Join a mutual group where you have a say. This is how we will read it today. Be among those that we teach also. So poor time management. Learn how to manage your time no matter what you are doing in these council exams. Like I said, I'm making a proactive discussion so that in case you listen to this before you enter the exam hall, it will help you. No matter what you're doing in the exam hall, make sure you finish your question. Even if your time is about to elapse, finish everything. One score can make a student fail. One mark can make a student pass. So learn time management. Don't rush everything to finish very fast, and don't be too slow. Don't write it down. Don't be too fast and don't be too slow. This is an exam that is going to determine your future, whether you become a registered nurse or a registered midwife. Like I said, why am I making this discussion? Counsel is becoming more difficult. And for you to pass counsel now, you need to do what? Study. You need to what? To study. You need to study. As counsel is becoming more difficult, you need a difficult study plan, a difficult study timetable. Stress your brain. The more you stress your brain, the sharper it becomes, the faster it becomes, the more articulating it becomes. You can't feed your brain with social. It's many of my wonderful students meet me and say, "Sir, please help me and be my mentor in this exam." I do help many of them, and I give them a brain demanding task, and many students are doing very well. Many of them are taking that task upon them, very brain demanding, and they are doing it. The last student from May Council, she passed her exam from Kogi State. And I was so impressed. Now she can have all the free leisure time now to herself. But now she's preparing for exam in a couple of months. Now you are preparing for exam in a couple of months. You need a brain demanding. Now, there are students that read that you need to. Another reason why students fail exam is lack of proper sleep and food. Diet. If you know that you're not a person that read at night, why are you going for night class? Why do you want to join others to go for night class? You see how it is not affecting your studies. If you know you don't read at night, don't force your brain. Because once the melatonin from the pineal gland is secreted, your brain systems will no longer be catching things. It will only respond to what the endocrine system is already saying. So if you know you don't study at night, don't stress yourself. If you know you study, now know the best time to study. If it is in the morning, early morning, you should know by now. If it is in the afternoon, you should know by now. If it is in a noisy place that you like to read, you know. If it is in a quiet place, you know where is the best place, the best time for your reading. Are we together, wonderful students? Notify me in the live session. Are we together? Hope you can hear me. Are we together? Notify me. I'm impressed. I'm impressed. Now, another reason why students can face lack of confidence. You see a student, like I said, this is a proactive discussion. That is why it is lengthy. So that even before your exams, you can go and listen to it. To build your morale, to build your confidence. After you've removed anxiety, another reason why students face lack of confidence, they don't believe in themselves. You see a student looking at another person, you see that girl, she's the most intelligent, and I know she has passed. You don't have confidence in yourself. Write it down. Negative thinking affects motivation and performance. Once you belittle yourself, once you think you can't do it, once you remove the confidence within yourself, you will see your body, your brain, everything will act in that order. But once you give yourself a big confidence, you will see yourself performing well in the exam. So how do you overcome lack of confidence? Believe in yourself. Believe in your ability. You can do it. Nose Brain said you can do it. Don't forget this. Yes, I am saying it again. What did Nose Brain say? Nose Brain said you can do it. Yes. Nose Brain said what? You can do it. So believe in yourself. Confidence is one of the important factors. You can do that Osce and pass it. Don't compare yourself with another. Avoid comparing yourself with another. It brings down confidence. Don't compare yourself with what? Another. Rather, improve yourself. Believe in yourself. Believe in your ability. Pray consistently. Pray fervently. And prepare consistently. Read consistently and believe in yourself. You find anatomy difficult, believe in your ability that you can, in this council exam, you will do it well. Another reason why students fail exam is what? Failure to read questions properly. Please, in your exams, make sure you read questions very well. Read questions very well. When you see things like priority questions, which one comes first, most appropriate. Most appropriate means all can be correct, but the most appropriate. So you don't just glance a question and say, yes, I know, I've seen this before, and you just pick it. Read question word properly. Identify the keywords in those questions before you do what you answer them. Another reason why students fail is poor health and lifestyle, lack of sleep. I've already said this. Poor nutrition. You are not eating well. Many of you are not eating well, which is very wrong. You need to do what? Eat well. You need to do what? Eat well. I'm impressed with Grace. Sunday, I'm impressed. Yes. Please, Grace Sunday, I would love to you've been following this discussion. Please make sure you notify me on WhatsApp. Are we together? I want to know you better. So notify me in WhatsApp on WhatsApp. I'm impressed for following this class. You are notified. I'm impressed. You are noted. Now, you need to what? Avoid poor health. Take care of your health. Don't sleep under mosquitoes. That you are claiming there's a difference between a student that is studying and a student that is suffering the body. You sleep under mosquitoes all in the name of night class. No, take care of yourself very well. This is a final exam. Take care of yourself very well. Avoid excessive stress. You are coming back from class by 5 p.m. You are rushing and you are trying to prepare for night class, and you know you've not eaten. You don't take enough water. You know that is poor health. Your brain needs glucose. While reading, you can go along with snacks. Sleep well. If you want to read at night, don't go to night class and start from 7 and you call it till daybreak, and you see someone that is doing it and you want to join. No, take care of yourself very well. Know your body capacity and take care of yourself very well. Avoid excessive stress, avoid dehydration, poor nutrition, eat very well, lack of sleep, sleep well. The sleeping well I'm saying is not you should sleep from 7 p.m. and wake up by 10 a.m. in the morning. No. When you have a good sleep for a short period of time, you will know that your body has recuperated. You do what? You start reading again. I didn't say have excessive sleep. If you know you are doing that, you are wrong. If you know you're eating too much, you are wrong, because you cannot read again after eating so much. So you have normal nutrition, balanced nutrition. Don't just depend on the food around you. For those in colleges and nursing schools, don't just depend on the school food. Buy food, cook food. Those in the universities that are listening to me, eat well, drink enough water, have an adequate sleep, not to sleep too much or sleep less. Have an adequate sleep so that your brain can recuperate. Avoid excessive stress. Like I said, coming back from night class, 5 p.m., you are returning to night class 7 without sleeping. It is wrong. So that you won't fall sick. When you fall sick, it's not the best. Now, this is where we're going to stop. There are certain myths people have believed about council exam. Number one is that it is impossible to pass. Now, always remember that Nurse Brainy said, you can do it, you can pass. Yes, students can fail council exams, but you that is listening to me, you that is my wonderful students in Nurse Brainy Academy, you can pass. Because thousands of students are passing, you too will pass. Like I said, with hard work. In fact, write it down. Nurse Brainy said, you will pass with hard work. Don't just believe. You will pass with what? Hard work. Write it down. Nurse Brainy said, you will pass with what? Hard work. Now, another thing students believe is that only intelligent and brilliant students pass. No. Who are those that will pass the exams? The disciplined students, that once it's time for their whatever the time in their timetable, they go for it no matter where they are, no matter what they're doing. They go for what they have at that certain time. The disciplined students is the people that will pass, not the one that is intelligent or brilliant. It counts. Everyone is intelligent, but the discipline is the difference. Consistency. You read today, you read the next day, you read 2 hours today, tomorrow in the evening you read another 2 hours, the next day you read another 2 hours. Consistency. Not you read 2 hours after you just said, "Oh, I feel so elated by what Nurse Brain said. I'm going to read for 5 hours today." And then next week you start, you relapse back to reading 30 minutes. No. You read what? If you are saying that now, I want every student now. This is the assignment I'm giving all my wonderful students. Chat me after this discussion and tell me how many hours you are going to be reading, so that I'll be checking up on you and follow you up. This is the assignment, because you, all my wonderful students, must pass. So one of after this discussion is, how many hours will you be reading? Number one review is that Nurse Brain said you can do it. When you put in hard work, you can do it. Don't forget this again. You can do it. Then number two is how many hours you will start reading, that you are going to keep as a consistent pace. I don't want you to read 30 minutes today, tomorrow 1 hour, next tomorrow 2 minutes. No, wrong. So chat me and notify me your study pace. I will start following you up. Yes, I'm impressed. Also, Ihoma Precious, chat me up, okay? All the wonderful students in this life, I'm impressed with you. So you need understanding. No, those that pass is not just the brilliant and intelligent, it counts, but those that pass is the disciplined, the consistent students, those that read without cramming, those that don't go and get a PDF and copy everything verbatim and say they have read, those that don't just pick past questions and begin to answer it one after the other. Favor Heritage, I'm impressed with you. Also chat me up after this. I'm impressed with all these wonderful students. School